A few years ago, very little was known of cancer cases. Currently, the world is experiencing close to 8 million deaths annually due to cancer that is fast turning into a killer disease. According to the World Health Organization, about 70% of all cancer deaths occur in low and middle income countries. Kenya has also seen a steady rise in cancer cases.
The incidence of cancer has increased because of the incidence of HIV, because there are certain cancers that are associated with the HIV disease. So it is a big burden and it's increasing.
Variation in the causes of cancer has continued to create fear of how people carry on with their lifestyle.
When you talk about cancer, it's many things that happen. Some of them are not known. Yeah. So one of the things that people think may contribute to the rise in cases of cancer is the way we eat food. Most of the foods we eat these days are refined foods. You know, the unga mahindi, unga gano. It's a white flour. We used to eat to cook the maize flour, right? When it's done, you know, just a bit of grinding, everything is in it.
There are changes in nutrition. It's not been clearly, the correlation between nutrition and cancer is not so certain. But obesity does increase the incidence of cancer, consumption of red meat, and also a sedentary lifestyle. And these have been found to be some of the risk factors.
Among women, breast and cervical cancer are the most common, and lack of physical signs and symptoms lead to late discovery of the chronic disease.
Because of the fact that cancer is painless and the symptoms come late, and the difficulty with treatment is more with late cases. We need to create awareness of early detection, because cancer is curable if detected early.
For breast cancer, physical examinations are advised, with further tests carried out to confirm the same. However, any lumps on the breast may not necessarily mean that it is breast cancer.
But in any case, we are getting some patients who have breast lumps, which is one presentation of breast cancer. But out of 10 breast lumps, only one is cancerous. 9 out of 10 breast lumps are usually benign.
Among males, prostate and colon cancer are becoming common, though some men continue to shy away from being tested.
In the first place, we were about 15 in the first lane, and apparently all of them left. We are just now left with another group that has just come. I think they thought that, maybe they are stigmatized of the same, or they feel that they didn't want to know their status for reasons which they know better.
Medics are further advising for regular checkups, especially among the elderly, for age is considered one risk factor towards cancer.
We have a recommendation for breast cancer because of the burden. So for breast cancer, we recommend is that every woman should know how to do their self-breast examination. They should be able to examine themselves and know what is suspicious, or if they have any questions, then they should be examined by a doctor. And it's advisable that even if you do not have any lump, to have examination by a doctor once a year.
Even as the government takes up the role of providing free diagnosis of cancer in its health centers, Kenyans are now up in arms on mitigating the rate of cancer-related cases. The faith-based organization is now seeking support as they come up with a cancer awareness center, hopefully by the end of 2013, at an estimated cost of 500 million shillings. Henry Minor, GBS News.